This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Oscocip Eye/ear drops is a prescription medication used to treat infections in the eyes and ears. It contains ciprofloxacin, an antibiotic that is effective against many types of bacteria. Indications and uses. This antibiotic solution is effective in managing bacterial infections of the eyes and ears, such as corneal ulcers, superficial eye infections, chronic suppurative otitis media, external otitis, and malignant otitis externa. It is essential to follow the doctor's instructions for effective treatment. How it works. It works by inhibiting bacterial DNA replication, which effectively kills the bacteria responsible for the infection. Directions for use. Always apply the drops as directed by your physician. Wash your hands thoroughly before use. Instill a few drops into the affected eyes or ears without touching the dropper tip to any surface. Avoid wearing contact lenses while using this medication and follow the prescribed dosage and duration for optimal results. Possible side effects. Common side effects include ocular discomfort, redness, and an altered taste. Rarely, severe reactions like eye inflammation or allergic reactions may occur, necessitating immediate medical attention. Precautions and warnings. Use of this medication should be monitored in pregnant and breastfeeding women, as the benefits must outweigh potential risks. Avoid using it if allergic to ciprofloxacin or similar antibiotics, and consult a doctor if you are elderly or have existing health conditions. FAQs. 1. What is the use of Oscocip Eye/ear drops? It is used for managing infections in the eyes and ears. 2. Can I wear contact lenses while using it? No, contact lenses should be removed before application. 3. What if I miss a dose? Apply it as soon as remembered, but skip if it's time for the next dose. 4. What are the side effects? Common effects include ocular discomfort and altered taste. 5. Can I stop using it once I feel better? No, complete the treatment as prescribed to avoid resistance. Thank you for watching. If you have any questions or suggestions, please leave a comment below. Your feedback is always appreciated.